Let's go.
Chicken noodle soup, chicken noodle soup, chicken noodle soup with a soda on the side. Thanks for tuning in to The Flu. I'm Haley Wilberton.
And I'm Ethan Hutchins. Today, The Flu will be discussing humor in healthcare. Humor can make a difficult situation easier to cope with or distance yourself from. It's a good way to connect with healthcare professionals and provide mutual support. It helps reduce tension between the patient and provider, helps the patient express their emotions, makes it easier for the patient to connect with the provider, and it can significantly reduce the embarrassment a patient may feel about an illness. Humor is such a strong tool in healthcare that professional organizations like the American Association for Therapeutic Humor have been organized to study and promote healthcare humor.
Well, isn't that great? Now when I go to the doctor, maybe she'll tell me a knock-knock joke. I don't think humor has any place in healthcare. I want my doctor to be serious, on task, and taking me very seriously.
Well, a recent study also shows that in addition to spending more time with their patients, doctors who use humor with their patients had significantly lower malpractice suits against them when compared to doctors who didn't use humor.
That just demonstrates better communication, not humor. Today we are going to be the fly on the wall of two different doctors' offices, Dr. Hadley and Dr. Shum. Both doctors have been practicing for years and think humor is always effective. Let's take a look at a visit with Dr. Hadley.
Well, congratulations, Alex. Seems you've caught the clap.
What's the clap?
It's chlamydia, and I know what else is clapping.
Well, wasn't that awkward? Maybe humor and healthcare don't always go together.
No. Dr. Hadley meant well. The joke just wasn't executed correctly. Let's look at a visit with Dr. Shum.
How you doing today?
I'm doing okay. Hurt my back in an accident. It was a really bad accident, so it hurts pretty bad. I don't know.
Car accident?
Yeah.
Or bike accident? Sex accident?
Car accident.
Car accident? Okay. Well, we can either lay on the couch or get on the table. I'm flexible either way. So.
I guess the table.
Oh, okay. Table it is. We're gonna do a few things here to try and stretch your back out.
Alright.
Some exciting stuff. Let's go ahead and get your leg down here and just stretch this like this. Oh, is it weird that I have a boner? It's okay. It's probably just the cleats. Let's just keep going with this. This feels good. This feels real good.
Please tell me, after that horrendous episode, you agree with me. No humor in healthcare.
I'll admit that was pretty brutal. Humor should never be forced onto the patient. Ethnic and sexist humor should also never be used in the doctor's office. Cynical humor is also less effective, and so is making jokes about the deceased. That just makes the doctor seem cruel and uncaring.
The patient should never be made uncomfortable. They are already going through so much with their illness, and tacking on crude and inappropriate humor, that just puts entirely too much on the patient. Humor is fine with your friends, but with your doctor, you need to be serious.
I disagree. Laughter can lead to reduced muscle tension and exercise for the heart. It evokes positive emotions, reduces stress, tightens interpersonal gaps, conveys caring, and relieves anxiety and fears associated with medical care. Let's take a look at two more clips depicting humor with Dr. Hadley and Dr. Shum. Watch these and see if they change your mind about humor.
Hey, Alex. So I have the results of your test here. First, I just want to say thanks for coming in and getting screened for an STD. That's really important for anyone who is sexually active. But the test did come back positive for an STD called chlamydia.
Oh, great. I have a clap.
Yeah, but don't worry. Chlamydia is really common, especially in young people, and we caught it early, so it'll be easy to treat.
That's good to hear. Let's hope I haven't spread it around, or else we'll have to call it the pause.
So what brings you back in today?
My back is feeling better, but I still have a little bit of pain, and I wanted to stretch it out a little bit.
Sure, yeah. Well, let's get you up on the table and see if we can stretch that out for you.
Okay.
Just trying to get your lower back good and stretched.
Ow.
Oh,
Ow.
are you okay?
Just kidding. Yeah,
good stuff right there. Hurt my back.
That was hilarious.
They did look like they were having a pretty good time. Makes me feel like there might be a place in healthcare for humor.
Humor in healthcare can be a great thing, but before using humor, feel the situation out. There are a lot of positives to humor in health, but it isn't for everyone. But if you have a good relationship with your healthcare provider and the jokes are appropriate, both parties can benefit from the interaction.
Thanks for catching the flu.
Chicken noodle soup with a soda on the side. Chicken noodle soup. Chicken noodle soup. Chicken noodle soup with a soda on the side. Chicken noodle